this year, we are in collaboration with one of the major sponsors in the Community Corporate Society, that is the Eastern Credit Union. And the programs that we have started with the training for the diabetes food care, where we train staff and medical personnel on proper care of the diabetic foods. And we did that level 1, level 2 training, and the training was certified by IDF, that's the International Diabetic Federation. And we also had the International Working Group on the Diabetic Food, of which I'm one of the 3 regional trainers for the Caribbean. After the training, we more or less collaborated with the Eastern Credit Union yesterday to do the Diabetes Awareness Walkathon, which started from the Storby Beach and ended at the mall, Gulf City Lowland.
Right.
And after that, there was presentation of the medals for the winners and the participants, and distribution of glucose meters, testers, to about 15 persons who may be less privileged and unable to afford some of those testing kits. So that was done, and also while that was going on at the mall, we had a health fair. The health fair focused on screening for diabetes, cholesterol, blood pressure, and we found some really interesting things. People just walking all along the street and their sugar is sky high, pressure sky high, So we did that. We also did a food care examination right there at the mall, as well as eye testing for diabetic eye diseases, which was facilitated by Ferrara Opticals. So that was yesterday. Right. So on Monday, we're going to be having the diabetes education seminar, which is, focused on secondary and primary school students. That's going to be taking place at the Michelle Gift Auditorium at the Scarborough Library, 9 o'clock tomorrow. We've gotten responses from about 12 schools with participating. We're close to 200, students that will be there tomorrow. Members of the public are also welcome. So we're starting that 9 o'clock to 12. We have 4 presenters. One of the presentations will be done by Dr. Roslyn Alfred, who is going to be presenting on understanding diabetes. And then after that, we have one of the dietitians presenting on nutrition as a prevention tool for diabetes. Then we have diabetes eye diseases by Dr. Dorian Dorica, an ophthalmologist. And the final presentation will be done by Dr. Alina Williams, who will be dealing with the psychosocial support for diabetics. That's for tomorrow.
Right.
The final thing will come on the 24th, where we are focusing on the diabetics and their family. So we're going to be having a diabetic patients and diabetes family, kind of family forum, where we will have diabetic educators and other allied professionals presenting to patients who are diabetic and their families, educating them and making them aware of what are the available support systems that are available on the island, and just trying to create some kind of psychosocial support.
Right.
Yep.
Excellent. So that was a lot. That is good. It's good even that you guys are going into the schools or interacting with the students from a young, from a young age, to let them know, some of the risk of diabetes and what it is.
Yeah.
So tell us, let's start from there. What is diabetes?
Well, diabetes is said to occur when the body is unable to deal with the mechanism of glucose metabolism and utilization, which eventually leads to elevation of blood glucose levels. The glucose and the carbohydrate that we eat per se are utilized by the help of a hormone called insulin that is produced by the pancreas. For some reasons that we may go into later possibly, the body is unable to utilize the insulin, the glucose, because of insufficient insulin production, lack of insulin production, or even defective insulin productions, and this leads to elevation of the blood sugar. And naturally, high blood sugar create an environment of toxicity to the tissues and cells of the body, and that leads to a lot of damages that occur. What you see in diabetes.
Okay. Who's at risk for diabetes? That sounds like everyone.
Practically, I could say we have different types of diabetes really, and the risks are pretty similar, but the type 1 diabetes is high, mostly genetic. Okay, it's inherited, and that is the body is just unable to produce insulin, and therefore the person definitely will need insulin to be able to utilize whatever glucose they're using. So that's type 1 diabetes. We also have type 2 diabetes, which is largely lifestyle, disease.
Yeah.
Okay, so you develop that as the adult, age, but unfortunately, the ages that people develop type 2 diabetes is now, getting lower and lower every time. You also have the gestational diabetes that we talk about, which is, brought about by the stress of pregnancy. Okay, the significance of that is that if you're diabetic when you're pregnant, it has impact on the pregnancy, impact on the mother, and impact on the child. And even after the pregnancy is over, the child is still at risk because eventually they may become obese children, and that primes them up also for diabetes in future. And secondly, the mother who has gestational diabetes, eventually, if no lifestyle intervention is made, about 50% of them eventually become diabetes within 5 to 10 years. So that is that. Then you also have the what they call the maturity onset diabetes of the young, called MODY. There are about 10 different types of those.
Wow.
And you also have the latent autoimmune diabetes of the adult, which is different type of diabetes. But because we really don't have the fine detailed diagnostic tool to identify those type of diabetes, it's not a very commonly talked about type, because sometimes we confuse them for either type 1 or type 2, and the treatment are pretty similar most times, but it's always good to be able to differentiate. So in terms of the risk factors, we talk about family, okay, genetic factors, okay, especially the type 1. We talked about in those ones too, certain viruses that infect, the human being could also trigger insulin problems, so virus infections could happen. Lack of exercises for the type 2 diabetes, unhealthy eating habits, overweight and obesity, of course, increasing age. The older you get, the higher your risk may be. Okay, and we also have ethnicity, because it's commoner in the people of color, we say, okay, the African population as well as the Indian population, they are at risk. The risk is slightly higher in the Asians. Okay, then you also have high blood pressure, because there's a connection between high blood pressure and diabetes. So eventually that may happen. Most people who are hypertensive may eventually become diabetic, and vice versa. Then we have poor nutrition, as we say. Okay, overweight or diabetes in pregnancy will also give you a risk of type 2 diabetes. So there are quite a lot of
I'm seeing that. I'm seeing diabetes. We have so much. I don't think we could talk about this in half an hour, because it's so much. I try to make everyone understand what we're dealing with. So once you understand it, you're able to make changes in your lifestyle, your habits, or find out your history, find out, what your great grandmother died from, or your great grandfather, and because you said type 1 is inherited.
Yeah.
And type 2 is a more lifestyle.
Yeah.
Right? So some of these things are just so important for us to understand here, and people helping people. So I noticed you also spoke about some glucose meters. I wanted to ask specifically about that. But what I also want to do, I want to invite persons, if you have any questions, text us on 489-3828 right now, and Dr. Adiyemi could, probably answer seeing that I'm full with questions, but I don't even know where to start because I don't want to push the limit. You know how the time runs out on us here during this segment, of course. All right, so 489-3828. Text your questions in, and of course you can ask Dr. You could also call as well and ask Dr. Adiyemi, but you can call on 639-8952 and have your question or questions answered. All right, so the glucose meters, Dr. Adiyemi. Tell me about that. How does it work?
Well, some 10 years ago, the Rotary Club of Southwest Tobago did a project in which one of these diabetes education projects, and we had partnered with a company that supplied glucose meters. So we had about like 50 glucose meters distributed at that particular year for people who are less privileged and unable to afford the meters, and they are diabetic, and they need to be checking on their sugar on a regular basis by testing them at home. So we championed that and got about 50 people to get the thing. Unfortunately, thereafter the program was introduced on the CDAP program. All right, and people were getting it, but I'm not too sure how that program had gone because occasionally they have issues with it. So about 2-3 years ago, in collaborating with Eastern Credit Union, that was also reintroduced on a smaller scale, where we get about usually between 15 to 20 persons every year. We distribute the glucose meters to them. They will have been pre-registered in terms of getting to know who may be in need of such things. They identify sometimes through the nurses, district head visitors, or through the communities, and then their name will be forwarded, and we will arrange for them to get the glucose meters free of charge.
But tell me, well, ideally, what I was asking, I want to know what is it?
It's a machine that actually that we use to test the blood sugar.
Okay.
So you take a little prick and you put one single drop on the strip, and after that you get your glucose measurement within 5-10 seconds.
I understand. Excellent. Someone is asking, does inflammation have anything to do with or influences diabetes?
Yes, diabetes is also one of the inflammatory conditions in the body, because we do have a lot of inflammatory changes that take place in the body, and that triggers different diseases. Atherosclerosis that leads to coronary heart diseases, and diabetes is also one of those. So it does play a role in the development of diabetes. Yes.
Right. So ideally, and I think I could ask you this, Dr. Adiyemi, because inflammation is one of the number one causes in
practically every disease. Because once the body gets to a point where you have inflammatory changes taking place, then anything could happen. Cancers, diabetes, high blood pressure, atherosclerosis, or different things could happen.
Wow. So then my next question would be, to define inflammation, or if we can define inflammation, let me see if I could find it, or if you can do a doctor definition for us this morning. I'll find one online. What is inflammation for persons who don't know what it is and understand what causes it in the body?
Well, there's inflammation and there's infection. A lot of people tend to confuse both together. Infection is when you have the body being, colonized by microorganisms, be it virus, or be it bacteria, or be it fungus. That is infection. Inflammation is when the body more or less reacts to changes within the body that causes it to, lose its ability to perform its function properly.
Right. Okay.
Just to try to be as simple as possible for people to understand. There are a lot of more technical terms, because when there's inflammation, there are a lot of inflammatory chemicals that are released, the cytokines, the adipokines, and different inflammatory hormones and chemicals that actually, causes a lot of changes within the body and could also cause cellular destruction.
Right. and I'm seeing so many different definitions
Yeah.
of it online as well.
Yeah.
You know, but it's highly related to the foods we eat,
Right.
fried foods and sweets and these kinds
Processed carbohydrate,
processed.
fried food, and stuff like that. Stress itself too could be a source of inflammatory
I've seen that.
protagonist. You know.
Yeah, it says systematic or chronic inflammation in women is highly caused by stress.
Yeah.
Interesting. I don't know how much more we could talk about, but this is it's opening some more ideas or topics or questions in my mind right now, Dr. Adiyemi. So let's say someone is infected. Let's say a 19-year-old is infected. Or is infected is the correct word to use in this case or no? Or diagnosed?
No, diagnosed as being diabetic.
Okay,
yeah.
right. Diagnosed as being diabetic, right? Let's say it's type 1. Let's say it's a type 1, which means it's inherited.
Yeah, those type 1 will have been diagnosed very early, usually between 3-4 years of life. That pops up in a year. So they will have to take care from childhood.
Okay, well, good. So it's a good thing I said 19. So, right. So in that case, how do we treat, or how does one treat, or the medical persons treat with someone like that? How does that person's lifestyle, or how is their lifestyle affected or changed or altered throughout their life process?
So you're talking about type 1 diabetes that have been diagnosed in children. Okay, in that case, obviously we know a lot of time the diagnosis could be very tricky, because if you don't look out for it and you don't get the proper history, okay, you may have problem diagnosing it, because the diagnosis of diabetes in children could sometimes be a little tricky, because they could mimic other type of illnesses before it is picked up. Okay, but once picked up and diagnosed, we know definitely that the underlying problem in that is that the child who is being diagnosed now have no insulin production, and therefore do not have any other choice but to be on insulin injection all their life, you know. Sorry. So they will have to be on insulin, and that is a major change in their life, in their day-to-day living, in their social life, in their family life, because the parents now will have to be educated about this condition, and they will now have to be counseled and educated about the care of the child before the child is able to be able to take care of themselves, possibly going into their teenage years and stuff like that.
Right.
Then the school system will have to be sensitized. If the child is, obviously the child will be going to school, so the teachers, the peers in the school will have to be educated, and the child will have to also be advised on how to deal with cases of if the sugar is too low or too high, the child suddenly goes into hypo and fall down, and the children don't know what is happening, So it's a lot of education that takes place, and this also brings in a lot of psychosocial issues for the child, the stigma and the self-esteem and all the other thing that comes with being sick. Plus, when that child enters into teenage years, now there will be a lot of other teenage issues that the child will have to deal with, a lot of emotional issues, now dealing with being diabetic again, and the aspect of adolescent diabetes is a different topic entirely, because there's a lot of issues with that. So we have to deal with the social part, we have to deal with the the puberty aspect, and the different hormonal changes and how it will affect their glucose metabolism and their diabetic treatment, their self-esteem problems. There's a lot of issues that are affected with teenage who are diabetics.
Right. Well, thankfully the conference is on tomorrow. You said it's open to persons to come at the Anne Mitchell Auditorium at the library in Scarborough. All right, so that's good. We have some more questions here. One person is asking if diabetes is, if it's basically they're asking if it could kill you, if it's something that will, kill you eventually. I mean, we all must die at some point.
Yes, diabetes is a silent killer. If you don't treat it, in the acute phase, the high blood sugar could, get you into a coma and, derail your body functioning systems, and you could die. On the long term, if it's not properly treated, diabetes eventually will damage the organs, the brain, the heart, the kidney, your foot, okay, and lead to different kinds of complications that eventually may lead to the person's demise. Yeah. So
Right.
there are different ways the diabetes can kill you.
Wow. Okay. Another question here says, if someone is diagnosed with diabetes and immediately makes a lifestyle change or make lifestyle changes in terms of diet and exercise, etc., right? Would that person have to be placed on medication?
All right, the treatment of diabetes is in stages. One of the things is if you diagnose it early and the patient has good self-efficacy, meaning that they are able to really comply with the instructions that are being given, lifestyle changes is one of the first options.
Right.
Okay, change your eating habits, try to eat healthy, balanced diet, and also weight loss. Most people who actually lose at least 7% of their body weight at diagnosis, they are able to, most of the time reverse the effect of diabetes. Okay, so weight loss, lifestyle changes in terms of diet, and physical activity is the first line of treatment for diabetes in terms of lifestyle changes. If that don't work, then we will add
Certain
medications.
medication.
Right. Okay.
Okay.
And over time, the medications work effectively, we'll leave you on it. If it doesn't, then we look for alternative combination therapy or insulin, depending on what the case may be.
Okay. Good. Good. Another question, quickly, because we just have about 5 more minutes. When persons, no, sorry, why do persons with diabetes often lose a limb? Often,
Okay.
yeah,
Lose
okay,
their leg.
yeah, my leg, right? I don't understand. Mm-hmm.
Okay, well, we know that diabetes is an inflammatory condition too, and also that the glucose that is very high in the body system is toxic to the body cells. Over time, it leads to destruction of the nerves and also the blood vessels, and when those are damaged, okay, it leaves the foot at risk. And because there's a nerve damage, when you get injured, you don't have any feelings. So when you have injuries and wounds that are going, people see their foot rotting and whatever, and they don't feel it.
Mm-hmm.
They don't see and they don't feel it most of the time. Okay. The other thing is that because diabetes in itself is glucotoxic situation, it damages and reduces your immune system,
Right.
and therefore your ability to fight disease and fight infection is reduced. When that happens, then infection easily takes over the body if it is not dealt with immediately. Therefore, so you have low immune system, destruction of the nerve, destruction of the blood vessels will put you at risk. Also, you have poor circulation coming with that, so that when you have injuries, and except it is swiftly dealt with, it may progress to things like we call gangrene, which could be dry gangrene or wet gangrene. Eventually, that leads to amputation, and then you have to take off the foot.
Oh wow, that's interesting. There's so much we could talk about this one, and Dr. Adiyemi. I'm so
Yeah.
glad that you're able and ready to just answer the questions off the bat. It says a lot about you as a doctor. Congratulations and continue doing your best. All right, so it's time for us to wrap up. I don't know if we have any more questions. Ideally, we just want to get all these questions in. I know it's Diabetes Week. If you're not joining us, we have Dr. Maxwell Adiyemi with us, and vast knowledge. Diabetes is bigger than than I imagined it to be, and not in a very good way, of course. It's a disease, a dis-ease, as we call it here. Anything else you would like to share with us, Dr. Adiyemi?
Well, basically, just to invite the public to our forum so that you can learn more about the disease and know how to help yourself. And most especially, the one we're having on the 24th is not only about the diabetic person, it's also about their families and
Right.
other people, so that you can be able to help some of the people who are diabetic in your family. Because we know from interacting with some of these patients, a lot of them need the support, and because they're not getting the support, they get very frustrated sometimes. They could be very daunted and really depressed at times. So we're trying to create a family kind of scenario around them to encourage them and to help them in the fight against diabetes, basically.
Excellent. Last question just came in the nick of time. Do diabetics rather crave sweets?
Yes, you could have craving for sweet, especially if you're diabetic. Now, even ordinary persons, sometimes you could crave sweets, okay? Pregnant women could crave sweets, but diabetics usually they will, because you are always in a constant, demand for something sweet and energy production, food, because your body senses that even though the sugar is high, your body still senses that you don't have enough, because what is in the system is not being utilized as a result of the insulin not pushing the the sugar into the cells. So even though your blood sugar is high, your body, the internal system, senses low.
Right.
You understand?
Yes, I do.
So it's not getting inside, so your body will desire and crave for more. And the more you eat, the higher the sugar gets anyway.
Wow. All right, so Dr. Adiyemi, tell us where, I am encouraging persons now, even myself, to go and get, what is it, a diabetic test?
Yeah.
Yes.
Okay.
Or blood sugar, that's what you call it, right? Yeah. So I'm going to get my test done soon. This week? Can I come?
Yeah, you can come. So we had a health fair yesterday where a lot of people got tested. However, practically every health center in Tobago has access to glucose testing, so you can just walk into any of the health center facilities. There are quite a number also private doctors anywhere, drugstores. Sometimes some of them are also doing that you can get tested anytime in Tobago. I think the access is just phenomenal.
Excellent.
It's available everywhere.
Excellent. That's the information I wanted to share last. So get tested for diabetes. It's more than we could imagine. Thank you so much for joining us this morning, Dr. Adiyemi. Yes, and I wish you a very productive diabetes week. I hope the information is shared and it goes a long way so people can learn and understand and make lifestyle changes. And you see, guys, lifestyle changes it's so important. Everything starts with lifestyle changes. What you eat, what you are is what you eat.
You are what you eat.
Yes, well, good. You said it the right way. All right, so that's how we're going to wrap up this morning's People Helping People.